Welcome to the Society of Hospital Medicine's Education Consult Series, brought to you by the SHM Academic Committee. This series is dedicated to providing hospitalists with practical, easy-to-use teaching techniques, tips, and resources from academic clinician educators. Today I'm going to be talking to Lanika Sood from Washington State University regarding setting expectations. At the end of this talk, you will be able to describe the importance of setting expectations for learners in a clinical learning environment and use a framework to construct an individualized document for setting expectations with your learners.
Hey Dan, how are you?
Good, Lanika. How are you?
I've been better. So I was hoping to call a consult.
Okay.
So as you know, I've been on the teaching service at my hospital. This is a new job for me, so I'm kind of struggling. I've been 5 days into the teaching service, and quite frankly, nobody's working really well. So my third year medical student is presentations are terrible. He's all over the place, does not have any clear plans, and seems pretty afraid to talk to our patients. One of my interns yesterday saw all the patient, but just omitted to see the sickest one on their list. And so I had to really work hard with that patient. And at the end of the day, the patient ended up needing to go to the ICU and nobody gave me a call. The other intern discharged 4 patients, but didn't finish the discharge summary. So I had to do them. And my senior is not a good senior at all. She shows up on rounds and is late every day and really looks like she's disconnected from our group. So I am truly overwhelmed and wanting to figure out if you have any ideas on how to improve things.
Yeah, unfortunately, I wish that were not the case, but that's pretty kind of a common problem that a lot of people run into. And I think one of the things that we found that helps teams work better together is to build and set expectations at the beginning of the rotation. So one of the things that we know about setting expectations is that if your students don't know their roles, then they're not going to reach their goals. And so setting expectations often can really feel daunting and sort of prescriptive, but it really actually saves time in the end because you don't end up having problems like this and your team works well together. And not setting expectation often leaves people feeling frustrated. So one of the things is that we can set clear expectations. So the things that I often set in my expectations are stating important values of your institution or what you value as your role within your group and with your learners. Often talking about specific logistics. What do you expect them to do? Where do you expect them to be on rounds? What time are rounds going to occur? Those kinds of things. Also thinking about presentation and documentation requirements. So if you want those discharge summaries to be done on the same day, setting that expectation ahead of time. And then also it allows you to set goals with your learners and figure out what are they wanting to get out of the rotation? What are their expectations about what they're going to learn while they're with you? And then it allows you to give them really pointed feedback once you understood what their goals are and what they're wanting to accomplish. So I've created this document that helps me walk through the expectations with my students. I tend to give them not only a written version in this, but I also sit down and talk with them for about 15 to 20 minutes at the beginning of the rotation. And it helps me sort of set expectations for the rest of the rotation. So one of the things that I like to do with my team is an icebreaker. Getting to know each other on the team really helps everybody want to work together. I think when you know the person that you're working with and the team that you're working with, it really does help solidify that team mentality. Do you think that going through this with your team might be helpful? If you think so, I certainly can walk you through some of the highlights that I like.
It seems pretty complicated and it'll probably take me an hour, but I'd like to hear how I can do it better.
Sure. I really don't think it will take that long for you. You can edit this document to whatever works for you and your rounding style, as well as your institution. My institution has a lot of requirements surrounding resident lecture time and different documentation requirements that are specific to our institution. I round a very specific way. So a lot of this stuff is very fill in the blank, and it's always editable to make it something that works for you and for your institution. Let's walk through a little bit. So for me, I always set some general ground rules after we do an icebreaker and kind of get to know each other. And I talk about when I want them to call me. So I always want them to call me or text me if there's a change in clinical status. So if you had that patient that went to the ICU, that's something that I would tell them beforehand that I want to know about. And then if they're not meeting that expectation, then that's something that we can give clear feedback on. I have my med students present on Monday, Wednesdays, and Fridays, and my residents present on Tuesdays and Thursdays. And that's so I can make sure that everybody on the team understands presentations and is good at making plans. And then hopefully our higher level learners are modeling for our med students. And so I put that in sort of my general rules, and you can set those general rules to be whatever you want. It sounds to me like you have a lot of different levels of learners on your team. Have you found that to be difficult?
Yeah, it's usually the students don't know what the difference is between the third and fourth years, and then the interns are not sure if they should be stepping around toes. So I think everybody is kind of muddled.
I think that going through the expectations, when I go through the expectations, I talk about the different learner levels and the expectations for each learner level, so that everybody understands that their roles are a little bit different and sort of how they interplay. One of the things I like to do, and you can delete, if you don't have a sub-I or a Med 4, you can delete that, or interns or whatever, however you need to accommodate that. I use the RHYME criteria, which is reporter, interpreter, manager, and educator, which is an evidence-based model that allows us to progress students and learners from novice to expert. I expect most third years to be reporters and be able to walk through a presentation, gather good data, and organize it appropriately. Your fourth years and your interns really should be interpreters and really starting to understand what those labs mean and how to interpret them to develop plans. Your interns and seniors should be managers to really be understanding how to manage complex interactions. And then your seniors, your upper level senior residents really should be managers and educators. And so not only are they managing the patients, but they're teaching to those folks below them. If you walk through each of the levels, it walks through expectations of how many patients they should see, when they should see them, when they should pre-round, those kinds of things. And so if you walk through each section that you have a learner for, hopefully will help them understand where they need to be with their learning. Have you told them sort of what they can expect from you as an educator as well?
Yeah, so quite frankly, I mean, what you just talked about is great. I just wish I had sat down with our students. I think I just want them to read my mind because that's the easiest. But you're right, I haven't told them that.
Well, I think it's never too late, right? So certainly setting your expectations. And I think part of it is letting them know what they can expect from you as well. So when are you going to teach? When are you going to round? What are you going to teach on? How are you going to round? Those things might help ease any anxieties they have about working with you and what they can expect from you as well. So I think as you go through the expectations you have of them, I think it also helps, I think, maybe take away some of their fears if you go over things that they can expect from you. And I always ask them, is there anything else that you want me to do for you? So that they have an opportunity to share any other expectations that they might have.
This is fantastic. So Dan, how can I get this document? I don't want to start from scratch.
Sure. Let me send you an email and a link to this document, and you can edit it however you want. And then after you set expectations with your students, one of the other things I always recommend is setting goals too. So what do they want to learn or what do they want to accomplish in the next 2 weeks with your rotation? And I hope if you set expectations and set goals with your learners, I think you're going to have a much better experience. Please let me know how it goes. And if you need any help from me, I'm happy to be available.
Thank you so much, Dan. This was fantastic. I'll keep you in the loop about what happened.
Great, Lanika. Good luck. And if you need anything else, please let me know.
Awesome. Have a good day.
You too.
Bye.
Just complete the survey to access the link to the Setting Expectations document. This document can be edited to the needs of your institution and to your own individual teaching style. Thank you for listening. Once again, please complete the short survey to allow us to assess how well we are meeting your learning needs and for access to the Setting Expectations document.